I didn't think that it would get that bad because, I mean, I've heard of other viruses, and throughout the years there's been like Ebola and Zika, and it didn't really get that bad to where we had to be quarantined. But now I kind of see that it's serious. People are dying, but then a part of me, it's kind of weird that a lot of celebrities have it, like a lot of famous people, but then I do look like in their lifestyle they travel a lot, and they probably do come in contact with some of the same people. But I mean, so overall it is affecting people losing their jobs. I work for the Department of Public Social Services, so a lot of people aren't able to come into our office and get the help that they need. We've been trying to do everything that we can, but it's kind of been overflow, like with the phones and everything. And now we're kind of teleworking just to prevent some of the workers from getting sick. So yeah, it is getting pretty serious, but hopefully everything dies down because I just want us to all be able to be regular again.
It is really unnerving. It's a little scary, but I think as long as we are taking precaution and keeping ourselves safe, staying inside, and only coming out with the essentials, I think we'll be okay.
At first, it wasn't being taken seriously, and now I feel like at first it felt extra, but now it doesn't seem extra anymore since how serious it's getting, and how we have to stay inside, which is pretty bummy. Can't go out and hang out, so.
To me, it's just sad that we've come down with this strange disease that we really don't know about. And it's probably a disease that we had before, but it's just gotten worse over time.
I believe it's overdid. I mean, it's like an overkill, but I mean, I see the reason why. Because, I mean, you want to be safe than sorry, because someone may just have it. So, but that's my, that's my outcome of it. So.
Well, it's made myself and others aware of, what our habits, and for the most part, many people's morals and standards have had to step up because this is serious, and folks need to be more serious about how clean they keep themselves and respect the law and respect what's being asked of them.
Now I'm stuck at home working, which is okay, but I actually miss my coworkers, and so it's just been stressful, just from work to home and all around.
It's kind of dull and kind of boring, but it's what we need to do to stay safe and to keep it from spreading.
Have you met anyone that actually has coronavirus?
No, I haven't.
That's the only thing that has impacted us more is we spend more time with our children now. Get to talk, eat dinner together, have breakfast together, As far as health-wise, it hasn't impacted us any type of way health-wise. Just socially-wise, you can't go out. They can't see their friends. My son can't play basketball. He can't, you know what I mean? It's affected them because they can't be kids. My oldest son, well, my second oldest, he's supposed to graduate. The baby's supposed to graduate. They're telling them that the kids can't graduate. They're going to have to redo it, do the term over. But that's really up to parents.
Like your everyday life is just different. Everyone's pretty much in fear. So people who have allergies, like I have allergies, I'm afraid to cough because everyone thinks I have the Rona.
Yeah.
So it's just kind of like my social life and work life is pretty dissipated. As of now, it's pretty stressful. It's a stressful time. There's a lot of uncertainty. Yeah. So yeah.
Yeah, for me as well. It's a lot of uncertainty. For example, during this time I want to shelter in place with my family, but in fear of if I'm a carrier and taking it to my older parents, I'm afraid to go see them because I don't want something that I do, my action cause them any harm. As well as my daughter, she's sheltering in place at college because she's afraid to come from DC here in fear that everyone's transferring or carrying the virus. So it's causing a lot of fear of the unknown.
And I also think, one last thing, I think it's fishy that these celebrities were able to get tested without any known symptoms.
Yes!
And you go on the mayor's website and it literally says you have to be over the age of 65 and shown severe symptoms before you can get a test. That's fishy to me. So to me, it's just all a money puller. But whatever, we'll stay home and social distance.
This is certainly not helping anything, to be honest with you, even with them doing the social distancing, I feel. Because if you're going to shut down Los Angeles County, you should shut it down completely and not have everything just half open.
It's not really affecting me because I'm still doing me. I'm still out here living life. I'm still out here making money. You know what I mean? I believe the only thing that can affect me is myself if I don't get out here and get out here to do anything. So basically, you know, it's not really affecting me. You feel me?
It's sad because a lot of people don't think it's real, and then when it start affecting people close to you, I think that's when people want to like realize and wake up about it. And it's messed up because we can only go out for essential stuff, but there's people out not really doing essential things, you know? So it makes it hard for the people that are taking this serious, you know?
Personally, it's been a huge impact as far as the level of stress and anxiety. I'm old enough to remember 9/11 really good, and this doesn't compare to that to me at the level of stress. That was more of a frightening situation and unexpected, of course, but this is more stressful internally for me.
I work from home most of the time anyway, so it hasn't really had a big impact that way. But it does because I'm in sales, so I meet the public face to face.
Has your business declined somewhat in the last 3 weeks?
Oh yeah, big time, because I sell cemetery property, pre-need. So I have to go where people are. And when there's no people gathering, I don't have that same type of lead sources I had in the past. We set up at swap meets, we set up at all kinds of big functions, and as people are passing, we approach and give them our flyers and our information so they can get their cemetery property arrangements made.
My job's closed. They closed it indefinitely, and I know I don't return back until my date is May the 6th.
I was a server at a restaurant. You know, coronavirus kind of took my job. I was making good money and making salary plus tips and $80 a night in tips. And now, you know, I've always been an entrepreneur, self-made person. I got my own line of car fresheners. I named them after me, and they're called Jacob's Famous Fresheners. But not only that, this is my motto. One spray will make your day. And right now, man, like, I usually sell air fresheners. This is for the car, for the home. But man, this coronavirus got me out here pushing hand sanitizers. These big ones is hand sanitizer.
I hope it hurry up and blow over, because I walk around with hand sanitizer. I got a big old thing of wipes in my pocket, you know, wiping everything down. So I stay ready.
So you're taking it pretty serious?
Oh yeah, oh yeah.
Now what do you have to say to some people who aren't taking it serious?
Hey, life is serious for me, you know. I can't speak on everybody else, but I mean, I value my life, and I have kids that I want to be around for.
I've been working nonstop in the ER.
Oh, is that right?
Day. Yes, I'm a nurse.
You work in the ER?
Yes.
Wow, okay, so this is great. Is it real?
Yes.
Explain to the people who are watching this is real.
Okay, I want you guys to believe this is real, and it's a big pandemic that's happening right now. We want you guys to take it real seriously about keeping your 6 feet distance, washing your hands consistently, because people are coming into our hospital being affected with this and are dying from this and are being severely put in ICU because of this. So this is a real problem that we're really trying to stress to people, that it's not fake, it's not something that they're trying to put out there, it's not something that the government did, it's actually a real virus that's killing people left and right.
All right, my question is, if someone comes in the ER and dies, how do you know they died of coronavirus when it takes, how long does it take to get a result from a positive coronavirus test?
Well, now we have it where one of the people that just did the test strips, who's making the test strips, we have it where we could test it in 5 minutes now.
Wow.
So now we have it where we can get the results back in 5 minutes and tell if you have it or don't have it. Before that, it usually took about a couple of hours just to get a result back on who was positive and who's not positive. One of the main things from stopping the spread of the virus is not to have too many person contact that's not in your immediate family. If it's not your immediate family, we say to stay in the house and to have as minimal contact with them, because the more exposure you have to other people, the more chances of you catching it. Keep your hands washed consistently. If you have a bottle of hand sanitizer, just keep a mini one. Keep your hands, as soon as you touch something, make sure you wash your hands and wipe your hands every 5 seconds, because people do not understand, when you wash your hands or when you use hand sanitizer, technically when you put your hands near dirt repels from the hands that are clean. Now if your hands are dirty, dirt will attract to it.
So do you think masks that I'm wearing like this are helpful?
No.
Why?
Us nurses, we're telling everybody, those who are not sick, who's wearing masks, it's non-beneficial because you still can catch it. You do not have the right mask on that blocks your blocks that are medically approved by a doctor and that blocks diseases and pathogens and stuff from entering in. And plus also you do not have the right gear for your eyes, because now also it doesn't come through your mouth, it can come through your mouth, nose, and your eyes. So whatever you touch, whatever is sprayed your way, it goes in through any openings.
And lastly, I want you to emphasize to so many viewers that are going to watch this that don't believe that this coronavirus is real, explain to them what you're witnessing firsthand that proves to you this is a real thing.
I'm seeing people dropping left and right firsthand, and not just from one hospital. I've been traveling, because I'm a female nurse, I've been traveling from multiple hospitals to fill in for nurses, and they are dropping like flies. And this is a big problem. This is not something that's a joke and that shouldn't be taken lightly. It should be taken seriously, because you, your friends, and your family could be the ones catching it and passing away from it.
And lastly, are you seeing people who are younger, and I mean younger, like 40 and under, that are impacted by this virus?
Yes. So this virus is not only just targeting people that are 60 and older. Millennials, younger, babies are now even attracting this. So that's why when we deliver babies in hospital, we're making sure we isolate them and put them in certain rooms, because now we have newborns that are attracting it.
What's your number one concern?
Me getting it or me infecting someone else to get them sick.
If I infect someone else and then they die.
My main concern is health issues, because I have health issues such as asthma and bronchitis, and I've been lucky not to, catch it or give it to anybody, because I really don't have it. Thank God that I don't have it.
My concern is when this is going to all be over with. That's my main concern. But I just hope that they take care of this situation, man, and everybody just go and do what's told of them or asked of them.
My number one concern is my kids getting sick. I have 2 boys. The oldest one suffers from intermittent asthma, and it does affect people with underlying health issues more, so I wouldn't want anything to happen to my kids, but they stay in the house. My oldest son doesn't go to a large school. So, I mean, overall, I'm just more concerned now, too, with myself, because I do have to go to work, and I am kind of exposed, and I don't know. We haven't been tested. So you don't know. In the test that they have, like with the County of Los Angeles, it takes 45 days. In 45 days, you can infect so many people. So that's just kind of scary. But I would want to get tested just to know. But then again, I'm not really worried about it, because I wash my hands a lot. I'm pretty clean. I'm not one of those people that don't. I take the washing hands and sanitizer and keeping stuff clean pretty serious, so I'm not really worried about me getting it or anybody close to me.
My main concern, I guess, is just trying to stay healthy, trying to comply with what the governor wants us to do. That's really my main concern, and not taking it home to my mother. She's over 70.
Honestly, I really believe that somebody just put it out there, you know what I mean? And it's honestly, to keep it 1,000, I really believe that the world is overpopulation. You feel me? There's too many people in the world. So it's like, they trying to get rid of everybody. Just my own opinion, you know what I mean? There's a lot of people in the world, and there's too many people, and they just trying to get rid of us, you know what I mean? And it goes back to the Bible, where they say the good shall suffer for the bad, you know what I mean? So, even the rich might, pass, and even the poor might pass, but, there's too many people in the world, so they trying to do what they got to do to get us out of here.
Do you know anyone that actually has it?
No, I don't. I really don't.
No, I don't.
No, I do not.
Not to my knowledge.
My daughter, one of her friends friends had it. She showed me a picture of her also.
My coworker, her cousin has it. There's like this guy that's really popular in Long Beach. His mother has it. You know what I'm saying? And she's like fighting for her life. So, and then I don't even think that, I think there's a lot of people with it that don't even know that they have it.
I can't say their names, but yeah.
Okay.
I've been in contact.
Yes, so I have a lot of colleagues, a lot of nurses of mine who have been affected of it, because the hospitals, we are not fully equipped to handle the mass majority of population coming in with it. And since we're not equipped with the right PPE, which is protective gear, the gloves, the suit and everything, since we don't have all of that, we're now starting to contract the virus from the patients.
No. I also would you're never going to know unless somebody gets tested, but you can't get tested unless you're showing severe symptoms.
Exactly.
And then there's a still 14-day incubation period. So we're all walking around, could have it, could not have it. So it's a huge-ass guessing game, and I feel like it's more political than anything, but that's my sense.
Can you go into that, what you mean by it's more political?
I don't know, it just something just feels funny about it. Like, kind of just the way the government dismantled itself, higher ups quitting and, you know, turning in their stock and stuff like that before the pandemic, even though it's been here. Corona's been here since November.
Yeah.
But the way that they're reacting to it makes it feel like there's something more, or they're doing things, changing things behind the scenes, and then this is just a cover because we all have to be home. We all can't do the things we want to do, so I feel like they're just hiding something.
Thanks for watching StreetTV.net. If you're not subscribed, please hit that button below and click the bell to receive alerts and notifications. Like and comment below to give us your feedback, and be sure to watch the 2 related videos to the right. If you want to support this platform or follow us on social media, visit the link in the description and listen to our weekly podcast, The Gangsta Chronicles, every Thursday. And thanks for watching StreetTV.net.